My specialty is hip and knee replacements, all complexity of cases. So we do from the less invasive, the partial knee replacements, all the way out to the biggest replacements, and then revisions as well. So I do about 30% of my cases are revisions. Most of the time, the revisions that come in will be from an outside institution. Once you get the volume going and you get used to doing it, the revisions almost, for the most part, become like a primary surgery for us. So I think that we're just a little bit more comfortable doing revisions, and a lot of people will send patients over for that reason. We prefer people to exhaust all the non-operative measures if they can. Then we show them the actual implant and discuss the procedure to try to make them as comfortable as possible, and explain to them I have several family members that have had replacements, my father-in-law, my grandmother, and kind of go through some of their recoveries and some of the ages and experiences that they were at when they had their joints replaced. It's still exciting every day coming into work. I like teaching, I like doing the surgeries that I do. Kind of get those butterflies before the start of a football, baseball game when you're lined up, ready to play, the whistle's gonna blow. Kind of get those butterflies like you're ready for the day. That happens every day I come into the OR. So it's, for me, it's the only job that I would choose to do.